Assalamu alaikum. Today we will be discussing the part 2 of muscles of the shoulder region. بعد ما أخذنا part 1 including the axioscapular muscles, the muscles that move the scapula connecting the axial skeleton with the scapula اللي أخذناها بالمحاضرة السابقة. Today we will proceed into the scapulohumeral muscles that connect the scapula with the humerus, and they obviously act and move the shoulder joint. With the video you will find an attached PDF file that include the pages from Gray's Anatomy for Student, وهذه الpages أو you can study the PDF directly. So in today's lectures our objectives is to first study the scapulohumeral muscles. We enumerate the muscles, know them, know each muscle, its insertion, origin, nerve supply, and action, and then identify gateways. The gateways أو البوابات أو passages في مناطق ممرات, these structures معينة, we should know their names and their boundaries, الحدود, شنو اللي يسوي حدود هذه gateways, and the structures that pass through each of them. And understand rotator cuff. Rotator cuff are a group of muscles. Rotator cuff muscles form stabilizing factors for the shoulder joint. They have a very important stabilizing factor for the glenohumeral joints. And to recognize the rotator cuff disorders, we have some clinical correlation, some clinical significance في أهميات سريرية ممكن نشوفها لها علاقة بالروتيتر cuff. And finally, to summarize the movements of the shoulder joints and the muscles that perform. First muscle is called deltoid, and you've already studied it. Deltoid is the largest muscle of the shoulder region. It forms the contour of the shoulder. هي اللي تسوي لي تدويرة الشولدر. It is a delta in shape. Delta means inverted triangle. Oid, deltoid. Oid يعني looks like, تشبه. So deltoid looks like the muscle that looks like a delta. It has a wide line of origin starting from the clavicle, the inferior or the anterior aspect of the lateral third of the clavicle, the lateral border of the acromion, and passes posteriorly to the lower border of the spine of the scapula. Gets inserted into a roughening, خشونة, on the lateral aspect of the midshaft of the humerus called deltoid tuberosity. طبعا, the origin of the deltoid is a mirror image, صورة مرآة للinsertion of the trapezius. وهذه مهمة لك، إذا نسيت وحدة تتذكر الأخ. إذا نسيت مثلا insertion of trapezius, you can remember it if you memorized the origin of the deltoid. Nerve supply of the deltoid is by axillary nerve. This is the axillary nerve. They يمشي around the humerus, and we will discuss the axillary nerve later. Deltoid is divided into three fibers. The anterior fibers in red here, also called clavicular part. The lateral fibers in green, also called acromial part. And the posterior fibers in the blue. All fibers converge تلتم and gets inserted into the humerus. Deltoid muscle is the main abductor of the shoulder joint. However, the range of abduction that deltoid muscle works on starts from 15 degrees onward up to 90 degrees. From 15 to 90 degrees. The abduction before 15 degrees or the initiation of abduction up to 15 degrees is done by another muscle that we will discuss later. All the movements of shoulder joint can be performed by deltoid except adduction. So the anterior fibers of the deltoid joints flexes the shoulder joint and medially rotate, while the posterior fibers extends and laterally rotate, and the lateral fibers, as we've already discussed, it abducts, it's the powerful abductor of the shoulder joints beyond 15 degrees. The second muscle is called supraspinatus, and as the name suggests, it lies above the spine of the scapula, supraspinatus. It takes origin from the supraspinous fossa and passes laterally beneath the acromion of the scapula and the acromioclavicular joint to reach the superior facet of the greater tubercle of humerus. So it passes beneath the acromion. Innervation is by suprascapular nerve. One important thing to keep in mind, as the supraspinatus muscle emerges beneath the acromion, it will pass through an osteofibrous canal. قناة متكونة من عظم والfibrous ligament, because we have a coracoacromial ligament bridges between the coracoid process of the scapula and the acromion, creating a tunnel through which the supraspinatus will pass. As the supraspinatus muscles will be in direct contact with the inner aspect of the acromion, remember, when we have a muscle near a bone, especially in relation to a synovial joint, we need something to reduce the friction between these two structures. So here we will have a bursa called subacromial, beneath the acromion, subacromial bursa that separates between the supraspinatus muscle and tendon and the acromion. This very bursa, it's the same bursa, extends laterally to be located underneath the deltoid. Remember, this is the deltoid, it's the most superficial muscle in the pectoral region. So it also will be called a subdeltoid, to separate between the deltoid muscle and the glenohumeral or shoulder joint. And this is very important to keep in mind. And there are another bursae related to the shoulder joint that we will discuss in shoulder joint lecture. Supraspinatus initiates abduction up to 15 degrees, and abduction will proceed by the action of deltoid up to 90 degrees. So supraspinatus is the abduction initiator of the shoulder joint. It also has another important function, is to stabilize the shoulder joint, because it is one of the rotator cuff muscles. That will be discussed later in this lecture. The other muscle is called infraspinatus, and it lies inferior to the spine of the scapula. It takes origin from the spinous fossa, infraspinous fossa, and inserted into the middle facet of the greater tubercle of the humerus posteriorly. Innervation, same as the supraspinatus muscle, by suprascapular nerve. Its main action is to laterally rotate the shoulder joint. And also, as it is one of the rotator cuff muscle, it acts as a stabilizer for the shoulder joint. The other muscle is called subscapularis muscle. It lies on the anterior aspect of the scapula, takes origin from most of the subscapular fossa, and inserted into the lesser tubercle of the humerus anteriorly. Innervation is innervated by two nerves, upper and lower subscapular nerve, and acts as a medial rotator of the shoulder joint. And as it is one of the rotator cuff muscles, we need to add lazim leaf. It stabilizes the shoulder joint because it is one of the muscles of the rotator cuff. The next muscle is called teres minor. Now, this small muscle lies just inferior to the infraspinatus muscle. It takes origin from the lateral border of the scapula on the posterior aspect and inserted into the lower facet of the greater tubercle of the humerus, also on the posterior aspect. So keep in mind, we have three facets on the posterior aspect of the greater tubercle. Upper facet for the insertion of supraspinatus, middle facet for the insertion of the infraspinatus, and lower facet for the insertion of the teres minor muscle. Teres minor muscle is one of the rotator cuff muscle. It's innervated by axillary nerve, same as deltoid muscle. However, its action is same as infraspinatus. They are closely related. Actions مثل الانفراسباينيتس. فشو يسوون؟ First, it laterally rotates the shoulder joint, as well as it stabilizes the shoulder joint because it is one of the rotator cuff muscle. Next muscle is called teres major, and this is the big brother of teres minor. It lies just inferior to the teres minor, takes origin from the posterior aspect of the lower third of the lateral border of scapula and inserted into the medial lip of bicipital groove. Remember, we have three insertions in the bicipital groove. We have laterally the pectoralis major, medially the teres major, and in between these two majors, we have two majors that latissimus dorsi lies. So two majors and latissimus dorsi in the middle. Innervation is by lower subscapular nerve as the subscapularis muscle. This is the teres major muscle is closely related to the latissimus dorsi. And here you can see that latissimus dorsi converged. Remember, latissimus means broad muscle of the back, dorsal. As it converged to تجمع fibers مالتها, it spirals around the lower border of teres major. تفتر حول الحافة السفلى من teres major to reach anteriorly and inserted into the floor of bicipital groove between the insertion of pectoralis major laterally and teres major medially. So it is closely related to teres major, especially in action. So we've mentioned that the innervation of teres major is by lower subscapular nerve as subscapularis muscle, and action it adducts the shoulder joints and also medially rotate the humerus at the shoulder joint. The tendons of the four rotator cuff muscles لما نختصرهم ب SITS muscles, SITS, the initials مال four muscles, supraspinatus, infraspinatus, teres minor and subscapularis. Their tendon will blend with the fibrous membrane of joint capsule of the shoulder joint. راح يندمجون مع بالإضافة طبعا إلى البوني attachment اللي حكيناه insertions of these four muscles. They will blend with the joint capsule, forming a musculotendinous collar. A collar يعني ياخة أو cuff. cuff يعني كف كأنه احنا ملبسين shoulder joint glove to stabilize it. So musculotendinous يعني cuff formed by muscles and tendons, and these muscles and tendons of course will surround the joint from anterior. This is the anterior aspect, anterior by subscapularis tendon and muscle, superiorly by supraspinatus muscle and tendon, and posteriorly by infraspinatus and teres minor muscles, leaving the inferior aspect of the joint as the weakest point in the joint. The rotator cuff muscles provide strength and stability for the joint because shoulder joint is highly mobile. Remember, it moves in different planes. It's a multi-axial, moves in different planes, and it has a wide range of movement. So inherently, this joint is unstable, has a weak stabilizing factors. لأن نتذكر اكو علاقة طردية بين الستابيليتي والmovement range of movement. كل ما زاد الستابيليتي قل الرينج of movement and vice versa. كل ما قلت الستابيليتي زاد الرينج of movement. فنقدر نخمن انه الشولدر joint is weak unstable joints. ف we need more stabilizing factors. طبعا من جهة راح ناخذها نحكي بمحاضرة الشولدر joint. So rotator cuff provides a stabilizing and strengthening factors. من جهة ذول هم muscles. فنشوف this is the anterior aspect and the superior view. We are looking from above. This is anterior aspect. فهنا نشوف subscapularis muscle grabbing the head of the humerus, ساحب الhead from anterior aspect. This is the supraspinatus from above. Infraspinatus and Teres minor from posterior. طبعا هذه الصورة نقدر نسويها بالمختبر بالعملي. We can hold the humerus by corresponding hand. يعني this is right humerus. We hold it by our right hand. فإذا ألزمه بالfour fingers كل finger راح يصير one of the rotator cuff muscles. The most posterior one هو teres minor, infraspinatus, supraspinatus, most superior one. ذول ثلاثتهم على ال greater tubercle of humerus والsubscapularis على ال lesser tubercle. Okay. بالإضافة إلى أنه ذول four muscles and their tendons forming a tendinomuscular collar or cuff that blends with the capsule of the shoulder joint, اللي provides stability and strength. In addition, there is a resting tone of these muscles. هذه المسلز during resting state بالحالة المريحة ما عندنا contraction to any of these muscles. هذول muscles عندهم resting tone. There's a contraction, very mild contraction. شو يسوي هالcontraction؟ يسحب لي head of the humerus and holding into the glenoid cavity. It provides further stability and further strength to the shoulder joint. These are the two main functions of the rotator cuff muscles. طبعا one more thing I want to mention, the name of rotator cuff. Rotator means the muscles are rotating. However, not all the muscles هم يسووا rotation. كلهم يسووا rotation طبعا عدا supraspinatus that only initiate abduction up to 15 degrees. Just keep this in mind. So we have a clinical correlation here. And clinical correlation تعني اكو ارتباط بين دراستنا للتشريح لموضوع معين وحالة سريرية ممكن ندرسها من الناحية التشريحية. بمعنى we have two rotator cuff disorders. The first one, both disorders by the way have been mentioned in your textbook Gray's Anatomy for Students. The first one is called shoulder impingement syndrome. And shoulder impingement means that the supraspinatus muscle, as it passes from its origin at the supraspinous fossa to their insertion at the greater tubercle of humerus, it passes through a narrow tunnel, قناة ضيقة اللي هي تتكون من الacromion, bone of the acromion, and the acromiocoracoid or coracoacromion ligament. هذا التكوين اللي هو بين الacromion وبين الscapular bones and the coracoacromion ligaments form a tunnel, narrow tunnel that is fixed, ثابتة. Any changes occur within this tunnel that reduces the diameter, يقلل لي من حجم أو من قطر الtunnel, أو any condition that increases the size or the volume of the muscle, يزيد لي من حجم المصل لأي سبب كان. أو سبب ممكن له علاقة بالsubacromial bursa that we've studied already. bursa اللي صايرة between the acromion and the supraspinatus muscle ممكن يصير بها inflammation تلتهب ويكبر حجمها، فراح تتضيق القناة اللي يمر بها supraspinatus muscle. فالمريض من يسوي لي abduction enlarged muscle أو narrowed tunnel القناة المتضيقة will pinch يعني تقرص المصل، أو يصير عندي impingement يعني المصل get pinched، patient will feel in pain. بس هذا البين شو وقت يصير بالspecific range of abduction اللي هو extends from 60 degrees to 100 degrees. هذا الكونديشن يسموها painful arc syndrome. painful arc يعني القوس المؤلم اللي هو يمتد من from 60 degrees to 120. patient راح يحس pain، ما راح يحس طبعا pain from initiation of abduction up to 60 degrees. هنا راح يبدي يحس بالألم، طبعا ممكن نشوفه حتى even on his face. وبعد 120 ما راح يختفي الألم أيضا. this condition occurs in young aged group. والمانجمنت مالته طبعا يحتاج إلى أن نسوي strengthening للروتيتر كاف muscles، نسوي exercises and strengthening training للروتيتر كاف muscles. ممكن يصير بتداخل جراحي أو تداخلات أخرى. The other condition is called tendinopathy. tendinopathy هذا يصير بالolder age اللي هم 50 و 60 و 70 years old. This occurs due to a diseased tendon. Tendinopathy means a diseased abnormal tendons due to poor blood supply للتندن due to aging process، عمليات الهرم والكبر، تصير تغيرات بالتندنز خاصة السوبراسباينيتس muscle. مرور الوقت راح يصير عندي inflammation of the tendon نسميه tendinitis. الsuffix itis means inflammation، إذا نضيف على أي organ يصير inflammation of that organ. فهاي راح نسميها supraspinatus tendinitis. With progression of the disease there will be a calcification of the tendon. فكالسيوم راح يتكلس وتتجمع به الكالسيوم minerals مع معدن الكالسيوم، فيصير عندي شيء اسمه calcific tendinitis. إذا أخذنا أشعة راح نشوف supraspinatus tendon كأنما bone يشبه البونز. فهذا this is the humerus وهذا insertion of the supraspinatus muscle. هذا ممكن يصير بها complication، ممكن تتضاعف، يصير بها مضاعفات، فيصير عندي partial or full thickness tear. طبعا symptoms الأعراض of the patient هي constant pain، ألم مستمر. patient cannot raise his hand above his head، ما يقدر يرفع ايده، خاصة مثلا المريض هذا يصير بالفيميل أكثر شيء، مثلا المريضة ما تقدر تمشط شعرها can't comb her hair. Now this is a table summarizing the muscles of the shoulder region with their origin, insertions, innervation and their action or function. You may notice that the numbers besides the nerves، هذه الأرقام والأحرف الأرقام اللي بصف النيرفز، هذه يسموها root values. راح ناخذ موضوع brachial plexus. So each nerve has a special codes or special root values. This will be studied later on. Now the gateways or passages that connects between different regions، البوابات أو الفراغات أو الممرات اللي تربط لي بين مناطق مختلفة. We have 4 gateways in this region. شنو اللي نعرفه لازم for each gateway? First we need to know which regions are connecting. شنو المناطق اللي تربط لي إياها عن طريق هذه البوابة؟ boundaries حدود and the contents، شنو اللي يعبر، شنو محتويات هذه الباسج أو هذا الcontent. The first one is called suprascapular foramen and it is formed by the suprascapular notch of the scapula اللي شفناها بمختبر suprascapular notch بالsuperior border of the scapula. It connects between the root of the neck. Now, the superior or anterior region to the scapula is called root of the neck, and the dorsal scapular region. هاي كل هالمنطقة اسمها dorsal scapular or posterior scapular region. خاصة الsupraspinous fossa تربط لي root of the neck with the supraspinous fossa of posterior scapular region. Boundaries inferiorly by the suprascapular notch that's bridged by the suprascapular ligament فيحول النotch إلى foramen. The second one is called triangular space, and it connects between the axilla anterior to the منطقة اسمها axillary region, which is anterior to the scapula, and our area هنا, our region اسمها posterior scapular region. Boundaries here, teres major inferiorly, superior border of teres major inferiorly, inferior border of teres minor superiorly, and a muscle called long head of triceps. We will discuss this when we study the arm. ناخذ الارم. So هنا راح يكتمل عندي ال triangular space. Quadrangular space, third space, has 4 boundaries. Medially عندنا the long head of triceps أو lateral border, يعني if we are specific. Inferiorly the upper border of the teres major muscle. Laterally هو الhumerus خاصة بمنطقة surgical neck of humerus. Superiorly هو عن طريق inferior border of the teres minor. هنا يكتمل عندي quadrangular space. The last space called triangular interval that's bounded by teres major, lateral head of long head of triceps, and shaft of the humerus. وهذا السبيس connects between the axilla and the posterior compartment of the arm, same as quadrangular space. So quadrangular space and triangular interval both connect the axillary region with the posterior compartment of the arm. What are the contents of these gateways or spaces? The first one is the suprascapular foramen that traverses the suprascapular nerve فقط, while the suprascapular artery and vein passes outside the foramen. However, both they follow the same course, نفس الطريق يتخذوه النيرف والartery, but only the nerve gets within the suprascapular foramen. The triangular space traverses and crosses an artery called circumflex scapular artery, and we will study this later. ناخذ تفاصيل arteries in this region. Quadrangular space contains nerve, artery, and vein. Nerve called axillary nerve that passes through the quadrangular space and spans at the surgical neck of the humerus, with artery اسمه posterior circumflex humeral artery. Posterior because it's on the posterior aspect. Circumflex يعني winding around, يحيط به. Humeral artery يعني يحيط بالshaft of the humerus بالsurgical neck, at the surgical neck of the humerus. And there is a posterior circumflex humeral vein also. The triangular interval, lastly, we have the radial nerve, a nerve called radial nerve that passes into the posterior compartment of the arm, and an artery called profunda brachii artery. Profunda معناها deep artery of the humerus. Profunda brachii, or deep artery of the arm. Profunda brachii artery. All these arteries and nerves will be discussed and studied independently in the next lecture, inshallah. To memorize and to easily remember the spaces and foramen, you can put your fingers like this, and this represents teres minor, this is the teres major, and this is the humerus, and this is the long head of triceps, and you can reproduce these spaces and the intervals between the fingers, and this is to review the contents of the gateways. Lastly, we will summarize the movements of shoulder joints and muscles responsible for each of these movements. The first movement is the flexion of the shoulder joints. Is done by deltoid anterior fibers, pectoralis major, especially of the extended shoulder joint. Already extended shoulder joint, and pectoralis major, especially the clavicular head. Remember, clavicular head is flexing the extended shoulder joint. Coracobrachialis and short head of biceps. This will be discussed when we study the arm. Extension is done by deltoid posterior fibers, latissimus dorsi, and teres major. And remember, these muscles are related especially in action. Abduction. Initiation of abduction is performed by supraspinatus. Remember, first 15 degrees and then proceeded by action of deltoid up to 90 degrees. Adduction is done by pectoralis major, latissimus dorsi, and teres major. Lateral rotation is done by deltoid posterior fibers of deltoid muscle, infraspinatus, and teres minor. And again, remember, these two muscles are related in action. Medial rotation is done by anterior fibers of deltoid, pectoralis major, especially the sternocostal head, latissimus dorsi, teres major, and subscapularis. This is the end of our lecture. Thank you.